Hi, Mr. Vaughn. How's it going?
Fine.
How are you doing today?
It's fine.
Good,
I'll
good.
be out of here.
My name's James Porter. I'm a urologist in Seattle, Washington. I work at Swedish Medical Center. I am a surgeon who specializes in laparoscopic surgery and robotic surgery, and the focus of my practice is treating prostate cancer and offering minimally invasive surgery options for patients with prostate cancer. This is Kinnikin. Everything went very well.
Thank you.
We were able to spare the nerve bundle on the right side. Okay. The left side we took widely because that's where the cancer was on the biopsy. We also, patients that come to me know that I do robotic prostatectomy with Da Vinci, and they want to find out more about, why should they do this procedure. And what I find when they have these questions is that they want to know about, if I was going to choose surgery, why should I choose a Da Vinci procedure over open surgery, or why should I choose surgery over radiation or brachytherapy?
When I went to my local urologist, he suggested radical prostatectomy or radioactive seeds, and I didn't like the sounds of either one of those.
When you compare surgery to brachytherapy, I think one of the major advantages of surgery is that if you do have a cancer recurrence after surgery, you still have radiation as a treatment option down the road. But if you do brachytherapy first and you have a cancer recurrence, surgery is really not a treatment option afterwards because the complication rate is so high and the difficulty in the surgery is so immense that most surgeons are not offering treatment after radiation, and those that are have very high complication rates. So it really is not a treatment option.
I really like the idea that, in order to get rid of something, it's really good to remove it. So I'm kind of already was predisposed towards, having it taken out. Yes, he did talk to me about the radiation, and in fact, we have some of the top radiologists in the area here for the seed implants. And he encouraged me to talk to them and find out everything about the seed implants. And I felt that, by having something totally removed, the likelihood of it ever coming back would be next to nothing.
So not only do I treat patients with prostate cancer using Da Vinci prostatectomy, but last year I was diagnosed with prostate cancer. I had been following my PSA for many years, and early last year there was a rise in the PSA, and I decided to get a biopsy, mainly because I was seeing so many young men coming into my office with prostate cancer. So I underwent the biopsy and found out I indeed did have prostate cancer. And I can tell you it was a huge shock. It's a much different situation being the patient as opposed to being the doctor. You go through a lot of different emotions, and eventually I knew I had to do something for treatment. I did, toy around with other ideas, but eventually it came down to surgery or radiation.
The seeds and brachytherapy were very interesting, but it wasn't the removal of the prostate. And in my mind, if I wanted to make sure that and make certain that the cancer wouldn't come back, I wanted to just remove the gland altogether.
When we take somebody to surgery who has had a biopsy, we often see a lot more cancer in the prostate than we would have predicted based on the biopsy. And so I knew with surgery that I was going to get the final word with regard to how much cancer I had, was the cancer contained within the prostate, was there any evidence of cancer outside the prostate. And that was important for me, and I guess you could call it the need to know. I needed to know that I could get on with my life, that this was behind me, and the only way to know that was to have the prostate removed. With brachytherapy, I was going to have this treated, but I really didn't know how much cancer I had because, again, the biopsy is just not the full story. So that was really a downside to me. And so based on those reasons, I decided to have surgery. And so the decision then was open surgery versus Da Vinci prostatectomy. And when I looked at, what I'd been doing and seeing the outcomes in my patients, and it was a no-brainer. I really, knew that I was going to go forward with the Da Vinci prostatectomy. And until that time, I had known other urologists who had chosen surgery, but I was the first one I knew that had chosen robotic prostatectomy, and was very happy I did.
You know, I woke up in the recovery room after having the surgery, and I felt pretty good. I could tell that somebody had kind of poked around in me a little bit because there was a little bit of discomfort, but other than that, I was in pretty good shape.
I think it was 3 weeks after my surgery, I went out to hit some golf balls one day, and he told me not to, but I did anyway. And somebody asked me to join him. I ended up walking 18 holes. So, looking back at that, that was amazing. Here I am walking 18 holes and playing golf after 3 weeks.
The first weekend that after my getting the catheter removed, I went out with a friend and we ran a 6-mile loop around Lake Union. And the next day, Sunday, we ran another 6.5-mile loop around Alki Point in Seattle. The second week after having the catheter removed, which would have been 3 weeks after surgery, I was racing again. I was going to Bellevue, and I ran a race at Bridle Trails Park, which was a 10K. Felt incredibly strong. It was amazing. No pain. You know, didn't feel anything from stitches or anything, and actually felt in very, very good shape. My son then, we're very active together. He said, "Dad, I want to go do this triathlon." And so we found a triathlon up in Bellingham, and so the next weekend we went to Bellingham, and we actually did a half-mile swim, a 22-mile bike ride, and a 5-mile run triathlon, and felt great. It felt really, really good. And so then he gave me the ultimate challenge. He said, "Dad, how about a marathon?" You know, and it had been not even a month, or just about a month, since I had been on the operating table. And sure enough, he convinced me that we should go do the Seafair Marathon, and so lined up and took off for a 26.2-mile run. And I have to say that that probably surprised me more than anything else, because, you know, it's one thing to bounce back and be able to go out and do these 10Ks and that, but a marathon takes a lot out of you. Even when you're in great conditioning, it takes a lot out of you. So I was quite surprised at how good I felt.
The catheter was out in 7 days. I had the answer on the pathology. I was, you know, back to my work in 2 weeks. You know, it was really nothing. I mean, I hate to put it that way, but it was just not that big of a deal. And I know I've seen open surgery patients, and I know what kind of recovery they go through, and it's a much bigger deal for them. With Da Vinci prostatectomy, because of the increased range of motion, it's like having your hand, a tiny, tiny hand, in the abdomen, but it's even better. It's more precise than my hand. It doesn't shake like my hand shakes. It can hold things that I can never hold with a normal open instrument. And so I can do better surgery. And not only can I do better surgery because of the instruments, but I'm being now assisted by a computer. So this is truly computer-aided surgery. And that's the next level. And that's the future of surgery.